Hi, thank you everyone. Thanks for joining us. Important topic today. So, too often women's pain is ignored, dismissed, and treated as an afterthought, right? But what happens when a patient is truly seen and heard? What happens when care becomes personal, when it's built on trust, respect, and partnership? Today we're going to talk about just that. We have Paige More, a patient turned advocate who spent years being dismissed by the healthcare system before finally being heard, and Dr. Elisabeth Potter, a breast reconstruction surgeon who believes that the patient should be always the most important person in the room. Their relationship is a testament to what happens when patient and providers truly listen to one another. So welcome Paige and Dr. Potter, and let's welcome them. So happy to see you. Thanks for joining, you guys. Okay, so before we dive in, I want to ask, what does it mean for both of you to be sitting on this stage in front of everyone, side by side, sharing your story?
You want me to go first?
Yeah.
Yes, always. To me, sitting here next to you means so much. I spent years being dismissed by so many medical professionals for so many reasons. And I think as a woman, so many people sitting in the audience here today can probably resonate with that feeling. As a previvor, somebody with a predisposition of cancer, I think so many medical professionals have pushed me away for so many years, dismissed my pain, dismissed my feelings, and I think that I allowed that to allow me to gaslit myself too. You are one of the first people that truly saw me, not just as a patient, but as a full person. When you told me the patient should always be the most important person in the room, that changed my life. And it changed how I carry myself in every other aspect of my life. So it means so much to share the stage with you today. Thank you.
Whoa. I mean, wow. You can already tell, getting to know Paige is like life-changing. So for me as a human being first, and then as someone who's had the privilege of being one of her physicians, I've learned that lesson that I knew deep in my heart. I knew that the patient was the most important person in the room, but she helped me take that to a new level and tell others how to get the most out of their doctors, right? Paige has made me a better doctor, and not just in like the one-on-one interactions that we have, but also in tackling really big issues that I, as a physician, didn't feel like I had the power to tackle, right? She showed me that there's a whole community out there of patients, and working together, our power to make change is unparalleled. So it's an honor.
Oh, beautiful, beautiful. I mean, I think it's important to talk through the journey to Dr. Potter's office. So Paige, kind of walk us through how you ended up at her door.
When I met you, I was at the most vulnerable time of my life. I was preparing to have a revision surgery. Like I mentioned, I'm a BRCA positive patient, so I have an increased risk of both breast cancer and ovarian cancer. And I had already gone through a preventative double mastectomy. I was preparing to have a revision surgery, and right before my surgery, I found a lump on my left breast, and I was terrified. I thought that I had breast cancer, which is one of my biggest fears. I've lost so many women on both my dad and my mom's side of my family to cancer. And my surgeon just dropped me. She canceled my surgery, and she gave me just no sort of care, no sort of tenderness, didn't check up on me. And for months, I went through all these sort of scans, MRIs, ultrasounds, trying to figure out what this lump was. And I couldn't find any answers. And I was just dismissed and just kind of left to figure it out all on my own. And it's really hard to navigate the healthcare system by yourself. And so finally, somebody suggested I'd come find you. And when I came and found you, and I was sitting in your office, I will never forget the feeling that within moments, you placed your hand on my chest, and you knew instantly what it was. You told me that I had just torn a muscle in my chest, and you said, ironically, the best way to fix it was to have a revision surgery. And after months and months of being so afraid, I felt so at peace with you, and I felt like all of my worries were just washed away. I knew I was in the right hands. You were taking care of me. And I just started crying. And I don't know if anyone here has ever cried in a doctor's office. It's mortifying.
No.
But you didn't make me feel ashamed. You kind of just held me. You asked, like, can I hold you? And you made me feel so seen and so safe. And I looked at you and I'm like, well, how could this happen? I've, had 5 years and this has never happened to me. Why now? Why did my surgery get canceled? And you just said, I don't know. That's the universe. And for a surgeon, a renowned surgeon, to not only say, I don't know, but also say, the universe? I just was like, wow, this is my person. I think I found my person. And it was amazing.
It's beautiful. And if you know Paige, she's very woo-woo and very into like signs and the universe. So this tracks. But Doc, like, wow, the universe. Can you talk a bit about it? Like, how do you think the universe brought you and Paige together in such a way?
Wow, magic. But I'm open to that. I receive it and want it and accept it when it presents itself. And I remember that day so clearly. I also remember the distinct feeling of, as a physician, being willing to be vulnerable with you.
Yeah.
And that's a really important part, I think, of a new kind of relationship, right? I remember feeling that I wanted to know what you were going through, that I wanted to help you, and that I wanted you to know what it felt like to be your doctor, right? Yeah, I can't explain how the universe did that, but in that same appointment that day, that vulnerableness for both of us led you to ask me, what do you need, right? And then you stepped in and said, there are things that I can help you with as well. I mean, it's hard to explain, but as a doctor, you rarely ever want to ask a patient to help you. But why? Help me help you more. And also, if there's something that I know my patients in my community is facing, we are the two people who understand that the best. How can we work together to change that for others? I don't know. I just think be open to the energy. Because magic happens.
Had you been vulnerable like that before with a patient?
I think yes, but you received it in a different way. Yeah. I mean, I think the magic for me in being a physician is always like just trying to help. Just try to help. Like, I am not the most important person in the room. I just want to be like a channel for helping you. And so you took it to a different level.
Well, because Dr. Potter that day told me, when I said, I started crying and I told her, it's been really hard for me. And I felt like I could say that to her, even though for so long, all of my other surgeons and all of my other care team had been telling me that what I was going through wasn't that hard and had been dismissing me, which is a horrible feeling. When you think that you have cancer and when you know inside, like I've been living with chronic pain and just feeling so uncomfortable in my body, and you have all of these other people telling you that that's not true, but you know it is, and people are constantly dismissing your pain, it gets to you. So when you validated it, and I said, like, I've been really struggling, you're like, well, I want to tell you, like, it's been kind of hard for me too.
Yeah.
It actually humanized you for me too. And it kind of helped, make you feel like you weren't this like authority figure in the room. And we then became equals. Mm-hmm. And that was this dynamic shift for me where it changed everything. And so then you opened up and you told me what you were experiencing. If you want to share a little bit about that, and that changed everything.
It's hard to explain, but basically, I'm a breast reconstructive surgeon, and there was this policy change that was looming behind me that was following me around like a shadow, where access to the most modern type of breast reconstruction was being removed. And so that was weighing so heavily on me. And when you asked, you sort of invited me to share, and I shared with you that I was worried for all of my patients, and I was worried for all women affected by breast cancer, that this change in policy might remove access to breast reconstruction. You said, I'm going to help you with that. And I can't explain, but this feeling of we're equals, I will use what I have to help you, and she wanted to use what she had to help me and help the community. We did change that. I mean, we wound up in Washington, D.C., in front of CMS and got that policy changed a year and a half later. So, I mean, like, yeah. And it wouldn't have happened if we hadn't been vulnerable, willing to admit for both of us, like, what are we struggling with? And how can we help one another? Not just like surgery, right? Not just that, but just being friends, being women who want to help one another, yeah.
It's interesting you say friends, because I'm sure everyone in the crowd can say that, oftentimes we get that hack, right? That like when you get in front of the doctor, tell your doctor, well, if I was your wife, would you? And if I was your sister, would you? And so the idea of a doctor or a professional having to imagine a loved one and to humanize the patient or have them care for them. What you guys bring to the table is like, you don't have to imagine the closeness, you can embrace the closeness. And so like, what was it about getting together that you guys like took a chance on each other in that kind of way and allowed yourself to be vulnerable?
I think that for me, I'm not special to Dr. Potter. Mm-hmm. And that's the most important thing that I want everyone here to know, is that you treat everyone like they're your sister. I mean, that's one of your sayings, And so I don't think that this should be the exception. This should be the rule. Every single doctor that you go to should treat you like you're the most important person in the room, not them. Every time you go to the doctor, you should know that you're getting the best care. You should walk in there and you should make sure that you feel so seen, so heard, so valued, because this is your life. This is not like, if they make a mistake or something, if they are not treating you like you are very important to them, this is life or death. And so I think that I'm not special. There's nothing different about me. Every single person here should be treated like that. And I think you showed me that. You taught me that this is out there, and I should expect nothing less from any other doctor that I go to now. And I'm so grateful for that.
I love this. And this isn't something that they teach us in medical school. In fact, other doctors have reached out to me and said, you shouldn't say that. You shouldn't say to anyone that you're going to treat them like they're your sister. There's something wrong with that. And I just completely disagree, because that is my superpower. When I'm in the operating room and I'm looking at tiny little blood vessels and I'm trying to sew them just perfectly and I need to summon that thing that makes it perfect, it's that sister test. It's me going, I'm going to crush this. Right?
Yes.
Right. We're not teaching doctors to be that way, and we're not teaching patients to want that and to draw that out of their caregivers. Right? It's so funny because doctors all want to excel. We all want to get an A, right? We do. And I want to crush it for you. And I want to tell you I'm going to crush it for you, and then let's talk about it again. I just think being that exceptional and going the extra mile shouldn't be taboo. And there shouldn't be something wrong with me for wanting to be friends with my patients, for wanting to care about them and know what their lives are like, right? That's not odd. That's just human. So, yeah.
And Paige, if you could, as your friend, I know that you have said that your relationship with Dr. Potter became so much more important because she was able to not just make decisions that was just the right one, but the right one for you. And that came through because your surgery was way more intense than you could have both imagined. And I'd like for you to share if you guys are comfortable.
That's you.
Yeah. So I ended up having a revision surgery with Dr. Potter 3 months ago. And we couldn't have imagined how much more intense it was going to be than what it was when we went in. And that's because my original mastectomy and reconstruction was done very flawed. And I think that what happened was I trusted my original team to do what was best for me. Unfortunately, what they did was they did what they are best at. And I think it's really important for us to have a better understanding when we go into our doctor's appointments to get clarity and ask the question, what is best for me? And I'm so grateful because now I know when I go into my doctor's appointments to ask, what are all of my options? I know to ask questions. I feel really empowered, but I also know to build really good, close relationships with my care team, because ultimately at the end of the day, you have to trust this surgeon. Because I didn't know when I went in for my revision surgery that you were going to find out that my original surgery was really flawed. And I have to trust that you're going to make decisions when I'm under that I'm not awake for. And so there is a lot of trust that we have to build. And I think you have to directly ask those questions. Are you going to do what's best for me?
Yeah, that surgery, so may I share specifics
Yeah.
a little bit?
Yeah.
So in breast reconstruction for many years, women's muscles were disregarded. And so that's across the board. So we put implants underneath the muscle. We divided the pec muscle from the chest wall. We did abdominal or belly surgeries that took the rectus muscle away. So as plastic surgeons and as reconstructive surgeons, we've had to confront this, that there were well-meaning surgeons who did surgeries even 10 and 15 years ago that are no longer serving those patients, that are actually harming them. And so Paige had a surgery where her implants were under the muscle, but in a way that I had never encountered before. It was called total submuscular reconstruction. So her implants actually had slid to the side of her body, right? So just almost to her back. I think being able to be honest about that. So I could have, not told Paige how bad it was and just fixed it. But she lived that experience in her body, and she had years of feeling a certain way in her skin. And if I hadn't shared with her the honest truth that was actually one of the worst reconstructions I'd ever seen, no harm, no malintent to the surgeon who did it. I mean, I'm not saying that in a personal way towards them, because they're not the most important person in the room. She is, and she deserves to know the truth of that. So, yeah, it was a powerful experience to operate on you, to share with you what I had found, to have the honor of fixing that, and also to recognize there may be a better, there may be something that I didn't do as well as I could have in 10 years, and be humble enough about that to say, I hope you find a doctor who listens to you then,
Well, and I appreciate because you used such beautiful discernment. When I got out of surgery, you didn't tell me right away, and you gave me time to heal and to process, and I think that was such a gift. But I also appreciated the fact that you did tell me what happened, because I lived for so many years with people not validating the pain and gaslighting me and telling me what I was living with and what I was feeling wasn't real. And so I think if you didn't tell me that, then I would never have known that those feelings that I knew to be true deep down weren't real. And so I think that what I want everyone here to know is that if you do feel like something isn't right in your body, if you do feel like something is wrong or you have pain, don't just push through. Don't feel like you have to just continue on. There is someone out there that wants to take care of you, that will take care of you. And I'm so grateful that you helped me with that, because I feel like a different person today. I cannot even believe that my body feels like this. I didn't know it was possible to feel this good in my body. And I want everyone to know that they can feel like that. So thank you. You changed my life.
Yeah, I think, no. I didn't, but all I did was tell the truth and treat her like my sister. It's not that hard. We can all do this. We can all do this. Yeah.
So for everyone in the crowd that's going to go home, and make appointments for their doctors and trying to navigate the fight for patient-centered care, how can they make sure that they are the most important person in the room? What are some takeaways, some tips you want to give them so that they can feel at least a little empowered to know, this is not right, I need to seek better, when is enough enough?
I would say trust your instincts and practice that. Practice what it's like to honor that voice inside you. And if you have that inkling that says, this doctor isn't listening to me, or just demeaned me, or I feel less than, move along. Don't waste your time there. It's not a good match, right? So I think listening to your instincts, I think expecting to get multiple opinions. So never walk into a patient, like to an encounter with a physician and think like, just because I showed up, I owe them something. I owe them the privilege of being my doctor. No, you don't. No, you don't. You're interviewing me. I'm showing up to this interview and I want to give you my best and then I want to follow through. I think also ask around. And if people tell you that they've had bad experiences, I mean, don't just ask one person, maybe ask multiple, but like, I'd go with instincts. I'd go with, interviewing your physician and then getting opinions from other people.
Absolutely.
I love that, 100%. I think you can definitely interview your doctors, and I think you can say no to treatments.
Yeah.
Do you care if I share a funny story that recently happened to me? Because I think it's a good example. So I recently had a toe corn. If you've ever had one, they're very painful. I can't believe I'm telling you this story. And so you're supposed to go to a podiatrist if you have a toe corn. I see some head shaking. Okay. This is why I wore closed-toed shoes. So I went to a podiatrist because you're supposed to go. And when I walked in, before the doctor even saw me, they said, all right, we have to do a full x-ray of your foot. And I'm like, an x-ray for a toe corn? This seems ridiculous. And so I said, no, we are not doing an x-ray before the doctor sees me. And the person looked at me as if, ooh, I can't believe they're saying no to this, but okay. So they took me to the back room. The doctor saw me, and I said to the doctor, are we sure we need to do an x-ray? I don't think we do. And he said, you're absolutely right. You don't need an x-ray. And I was so proud of myself that I advocated and saved myself thousands of dollars, right? Or hundreds?
Hundreds.
Okay, fine. I think I'm a hyperbolist. I saved myself hundreds of dollars. So I want to leave you with it's okay to say no. Advocate for yourself because you are the expert of your own experience. You know your body best, and you can say no. Right?
Absolutely, yes.
Love it.
We agree. Paige, again, for someone knowing you, I am just so proud to see you kind of take up space. I want maybe the final thoughts you can share with people about this relationship with Dr. Potter and going through this such rigorous surgery that you're still healing from has bled into other parts of your life. Because I think that's what people need to know is that advocacy shouldn't be limited to just the doctor's office. That you can take up space in other places. So please tell us a little bit about that.
I think you can take up space in every aspect of your life, and you should. I think you should know when to leave certain relationships. I think you should know when to stand up for yourself, whether it's with your family, whether it's at work. You know what room you're supposed to be in. You know what doesn't feel right. And I think that our relationship has helped me feel so empowered to know that I do know who I am. I know when to speak up, but also when to be really humble. And I think that is so beautiful that we have this relationship where we can share a stage, we can help each other shine. And I think that's really, really special. And that's changed my life in so many ways. So I'm really grateful for that. Yeah.
I'm grateful for you, and grateful for you, Doc. We're grateful for you, and this is what changes. Taking up space, speaking up is what changes the world, right? Change your life, change the world. Mm-hmm. And these are two change makers, and so we're so privileged that they were there sharing their stories. Thank Dr. Potter, thank you, Paige, for sharing, and thank you for joining us.